around to bring you along for my 1-year visit update after my rhinoplasty. So come on. Hey guys, welcome back to our YouTube channel. Today is an exciting day for me because I am here with my favorite, Dr. John Paul Tutela, who
Hello.
is a plastic surgeon, and he not only did my boobs, which everybody knows that, but we're not here to talk about that today. We're here to talk about my nose. So welcome, Dr. Tutela, and stay tuned for your top 5 questions on rhinoplasty. Okay, so when you are first interested in going for a rhinoplasty consultation, where do you start? What do you even begin to do first?
Sure. Well, I think one of the most important things you have to do is find the right surgeon. And that's super important. So it's important to find somebody who's board certified by the American Board of Plastic Surgery. And that's how you'll know that they've underwent the most rigorous training in plastic surgery, as well as, the most updated.
Right.
And then, looking through people's results and reviews, and of course meeting, with them in person. And a lot of times, you'll meet with, more than 1 or 2 or 3 surgeons. And I think finding somebody who you're comfortable with really speaks volumes, because it's going to be, a very close relationship that you guys are going to have, especially for the first, bit of time right after the operation. And you want to have somebody, again, who you're comfortable with, who you trust. And, sometimes, 2 people, when they get together, they either jive a little bit better,
Right.
or not so much. And, you want to be going into this kind of stress-free.
Right. Yeah, I totally can co-sign that and agree with it. When I initially came for my consultation, I did come to Dr. Tutela and I did do my research and checked out a few others. And honestly, I just had the most natural comfortability with you.
Yeah.
And I think it's sometimes referred to as bedside manner when you're a doctor, because
Yeah,
you're so highly educated in your field, but you also have the ability to be relatable and comfortable to
Yeah.
someone as a human, which is so important when you're going under the knife and you have no idea. I don't work in the medical field, so I have no idea what any of this entails. So you want to make sure you're comfortable, but with a professional at all times.
Yeah, absolutely.
Yeah. Okay, cool. So one of the biggest questions I got from all of my fans and followers was price point. And I know it's something that is not a black and white answer,
Sure.
because everyone is a unique case and has different needs and different wants. But what kind of range are we looking at when we're talking rhinoplasty?
Sure, I think that's a great question. One of the most important things is kind of where you are geographically in the nation, right? In general, the prices tend to go up around major metropolitan areas, New York, Miami, LA, and then you could find, much lower prices kind of in the middle of the country. If you're kind of in a more rural area, the prices are going to be a little lower. But, for a place like New York, I would say, the prices could kind of fluctuate in the $10,000 range for a primary rhinoplasty, and that just means a rhinoplasty on a nose that has not been operated on before. And that can increase significantly, depending on if you've had complications previously and now you're talking about revisional rhinoplasty. So those cases are, one, a little more difficult, they can take a little more time. So, that price range, then starts going up a bit. You could be in like the $10,000 to $20,000 range. And again, all these things are kind of probably plus or minus $5,000.
Right.
Even with primary rhinoplasty, and so it could even also fluctuate just from one surgeon to the next, depending on their experience and stuff like that, and how sought after they are. But I think that will kind of get you in the range.
Okay. So we're talking, I would say, minimum around metropolitan areas, 10,000.
Yeah.
entry level for non-revision. And then depending on what you need done, it can go anywhere from there.
Right.
Up 5,
Yeah,
up
maybe
10.
up to 20. Yeah, sure.
Depending
Absolutely.
on specific needs.
Absolutely.
So,
and there's going to be like some places, you know, that'll have it, you know, maybe a special or something like that.
Right.
Just shy of that. But
yeah. So that's a good idea of a range to have in your idea when you're talking about, you know, getting into it and, you know, planning for it in the future, just having a ballpark range. But with that being said, I think that's a great transition to go into what we did together on my nose and
Sure.
what specifically I needed, because mine was, I feel like, just as complicated as most of them are, because everyone's a little bit unique and needs little different things. So in explaining some of the things that I had done, maybe you can see just how complicated a rhinoplasty is, and it's not cut and dry of just like a one-size-fits-all type thing.
Absolutely. So the first thing we did in your operation was a septoplasty, and that's the central portion of cartilage that kind of runs straight down the center of your nose, kind of splits like one nostril from the other nostril, kind of separates the two sides. And by taking out a small little portion of that cartilage, you're able to straighten the nose a little bit. You had a little bit of a curve. And that is actually also done for a lot of people who have breathing problems, where the septum is very, very curved and kind of narrowing one side of your airway. So a lot of times that can also have the effect of increasing nasal breathing, making that a little easier.
Yeah.
So we started with that, and then you had a little bit of a hump, you know, that was both made of bone and cartilage. So the bony part of the hump is kind of rasped down. The cartilaginous part is kind of shaved down more with a sharp instrument. And then, you know, once you do that, a little bit of narrowing of the nasal bones. And so what's, you know, physically going on at that part is that's when the bone is being fractured and then brought back together. So that's what, like, a lot of people will talk about, like, oh, did your nose get broken for your rhinoplasty? And so that's what's going on there. And it kind of makes it all a little bit smaller, just overall on your face. And then the tip, so the cartilaginous tip, also was refined just a little bit, and that was kind of sutured together just to bring the tip and again make it all smaller and just kind of fit all the other things that we did. So it all kind of fits together as like a harmonious unit, and and that, you know, depending on, you know, other people can have like a really bulbous or boxy tip where that work is happening a little bit more aggressively. But that was, you know, basically it for you, and then you kind of sew it all back together.
So to me, that sounds very complicated and like a lot of work. So that I wanted to share this information with you, because a lot of people think going under the knife is something really simple, or that it's too difficult to even imagine doing. So one, it's within reach. If it's something that you've always wanted to do, I've always wanted to get my nose done since I was 15. I waited until I was 30-something to do it. I wish I did it sooner. That's the only thing I wish I did differently. But I'm happy with when I did it, because I found Dr. Tutela in the perfect timing to make me feel most comfortable in making that leap and having that, you know, that fearlessness to do it. And I'm so happy that you gave me that comfortability, because it improved how I feel about myself. And that's really why I did it. I didn't do it for anybody else. I did it for myself, and that's always why you should do any kind of plastic surgery, I believe. And find a board certified plastic surgeon, because they know what they're talking about, as you can see.
Absolutely, that's important. And really what you know, you just said, I think is probably one of the most important things is, one, make sure you're doing this for the right reasons. When it's something that you've always wanted or you're really interested in, and it's kind of all about you, that's when you're gonna have you know, the happiest patients, right? Because it's something that they're worried about that then gets, you know, addressed, and you know, then they're happy. But if you're doing it for somebody else, you know, then it's kind of hard to say, like, well, are you going to be happy with this result or not? Like, it's something that you don't even necessarily think you need. So, I mean, that right there is kind of the crux of, you know, all cosmetic procedures is something as small as lip injections or something as big as surgery. And it's something that shouldn't be taken lightly. And I think that's also important, because so many times we're able to go on the internet and look at things and see results and even see the procedure, and you kind of get a false sense of security maybe about how easy it is, but it really should be taken seriously.
Absolutely.
And you should do your due diligence when trying to figure out what it is exactly that you want to do, who you want to do it, and just even the commitment of going through with it yourself and having surgery done.
Let me ask you a question that just came to my mind now, but I think it's a really great question for anybody watching this video. When you're doing that due diligence and looking for before and afters and people's own experience, what is the best resource for something like that? Because Google is unlimited.
Sure.
So you want to be careful what you're reading and what you're believing in.
Right, absolutely. There's a lot of great resources out there. I think actually Real Self is like a wonderful resource for patients really in any sort of cosmetic arena. It's just great because you get a lot of information about the procedure itself. You get a lot of information about other people's experience. It's kind of like a social media site for plastic surgery. So people
I have
are
the app on
constantly,
my phone.
yeah, it's great. People are constantly, updating their progress. So you're gonna hear somebody's specific story from like consultation, all the way through recovery and post-op, 1 year, 2 years later, their experience with specific doctors. So you'll really be able to get a great idea about their reviews, even, their staff, and you'll really be able to prep yourself for your in-office experience.
Yeah.
So I think it's wonderful. And they also have a lot of things like national averages on pricing and also like regional averages and stuff like that. So there really is a wealth of knowledge that can be seen on Real Self.
Yeah, I found Real Self. I think I found Real Self once I had booked my breast augmentation with you, and you told me about it.
Right.
And then I started then I went down the rabbit hole.
Right.
Real Self, because it's like anything else on the internet, but it's just so educational and so much information. It's just endless. And also, if you ever hear of a procedure you never heard of, or like a new instrument, the first thing I do is go to Real Self to see like what people are saying about it on there, what doctors are doing it, everyone's point of view, and it's a great resource for any kind of cosmetic procedure.
Yeah, and any procedure they'll even have something like patient satisfaction. You look at even percentages and kind of more tried and true things like breast augmentation. You see it's like 98% patient satisfaction, and other things like cool sculpting. You kind of start to see that just kind of die down a little bit just because of people's various experiences. So it's really a great resource just to kind of start.
Yeah. So what do you think is the best, like maybe top 2 points when you're picking a surgeon for yourself?
Sure. So, let's say after you've gone to consultations and now you're trying to figure out exactly who you think is the best fit. And, we had just mentioned this just, a moment ago. Certainly you want to make sure they're well trained. So board certification lets you know that they're in good standing with the national board. So I think definitely start there. And then, their results. So you want to see like what are they able to deliver, on a kind of consistent basis, and then again, how you get along with them. If you feel uncomfortable with somebody before they even do anything, I can only imagine it's not going to get any better.
Yeah, you're not going to be happy if you're a little uncomfortable in their consultation room. You are not going to be comfortable in the OR room with them when you walk yourself in. So energy is a big thing for me, and this is one of the areas where you need to be in tune with how you're vibing with the surgeon for sure. So I think the number one question I got from everyone was, what was the recovery like? how painful was it, I'm scared to do it, how long do I have to be out of work, like everything having to do with recovery.
Right.
So I was most amazed at the recovery process that I went through, so I think we can both speak to it from his point of view as a surgeon and mine as the patient.
Absolutely.
So if you want to go ahead first with your
Sure.
point of view, and then I'll add on mine.
So when it comes to rhinoplasty, it's interesting. The post-operative pain is not nearly as bad as you think it would be. You know, especially, after hearing a description that your nose is being broken, and, if you actually watch the operation, you would say like, wow, that looks like it's gonna hurt. But really the post-operative, pain is kind of minimal, and I don't even really prescribe narcotics for my rhinoplasty patients because they really don't need it. Other than pain, you could definitely expect swelling, bruising can be variable, and the swelling around your nose. The interesting thing about your nose is it really holds on to swelling a lot. So you're going to be swollen the first couple weeks is like, wow, your nose looks really,
it might look
like
the same
thick.
size as
you're
when
almost
you
like
went
what
in,
happened
just
with
a different shape.
Yeah, exactly. And then, it can really take 6 months. You're going to see a lot of improvement in the swelling, the first 6 weeks. And at 3-month mark, you kind of see these are kind of big, time periods. At 6 months, a lot of it is gone. But really, a nose can hold on to swelling for almost a year, which is kind of what brings us to, today for you, right?
Yeah, so it's exactly been a year since I got my rhinoplasty. And exactly what Dr. Tutela had told me beforehand and today with you guys listening is that the nose holds on to swelling for a long time. So what brought me into finally getting my nose done was having booked my wedding and knowing that was around the corner and it was happening, and whether I liked it or not, my profile was going to be photographed all over the world and for everyone to stare at in my photo albums forever. And I just did not like that idea. It was not the look I was going for my wedding. So I came right in here and I said, listen, we have until November to find out how to do this and get the swelling down. So we scheduled my surgery for July 26th, 2018. My wedding was November 1st, 2018. So it was very close, but I was so thrilled and happy with the results that I felt confident as myself walking down the aisle that day. And I definitely did still have swelling, but I just was happy to have done it and moved forward, and I fixed the part that bothered me the most, which was my profile. And luckily, when you do your profile, the swelling had gone down here significantly by the time it was the wedding. The tip of your nose is which bothers most people, and of course it bothered me, but not as much. Like, I was confident in who I was to begin with, and that's something that was just something looks that way on me always. So the tip definitely held on to swelling. I was swollen there. But today, when you see the before and afters that we're going to show later on, you'll see the significant difference from the tip from when I had it done back then and the first few months recovery until today. It significantly went down. So if you're trying to do this before a special event, the more time the better. If you have a year, then great. If you're pretty confident in who you are and you feel comfortable with the surgeon that you found, I was good in 3 months. So I was happy to walk down the aisle and have my new nose. And the recovery process for me was, honestly, it was pretty shocking. So I had gotten my breasts done a year before that, which was a little bit more painful because I think when you're getting up and going to the bathroom and trying to do things, you're using your core and you're using your muscles and that are like underneath your chest or above your chest or whatever's happening down here. I don't know anatomy, but you're using that muscle to sleep and to get up and to be moving around, and that was more painful for me. When I had left the operating room the day of surgery, I remember getting in the car. It was in the city, and I took a selfie and I sent it to like my whole family, and I had a bandage on and like blood on me, and I'm like, I feel wonderful. And like, granted, like there was still anesthesia, like all of that. I went to the hotel, Mike was taking care of me, and like the pain just never set in, and obviously I was uncomfortable. I couldn't breathe. But like he had said earlier, I did have a deviated septum. I haven't been breathing well my entire existence on this earth. So I've had plenty of sinus infections, and I know what it's like to not be able to breathe. So I was just very, very congested. Sleeping was hard because I'm a side sleeper, so I had to keep making sure I was propped up to fall asleep and not have any kind of injury, because you don't want to like all of a sudden pass out and then you're like laying on your nose. Like that would freak me out the first couple of months.
Right, sure.
But honestly, like with the recovery, that was the thing I was most worried about, was falling asleep and like hitting it, because there was no pain. I really never had pain, and I remember coming in for my 1 week checkup or something, and I couldn't believe it, and I said to him, like, I have no pain, is anything gonna happen? And he's like, no, it's over, the painful part happened. He's like, I took a chisel to your nose, like
Right.
if you're not in pain now, it's not gonna come on later on.
Right.
So I have to say, medicine is pretty advanced these days. I do have friends that had their noses done in high school and that had completely different recovery experiences, but I also think it's case by case basis. I don't think everyone's gonna have an experience I had. I think a lot of your recovery comes down to your mental attitude about it and having the outlook of, I had surgery, I went under the knife, I had anesthesia, I need to be prepared for what's to come from that. And not thinking it's gonna be a cakewalk, but knowing that there's light at the end of the tunnel and you'll be fine at the end of the day. So I had a great experience. I did take Arnica, which is a natural supplement over the counter. You can get it at Vitamin Shop, is where I always get it. And I took that the days after the surgery, and that got rid of my black and blue discoloration under my eyes pretty immediately. I think within like 10 days.
Yeah, it kind of helps things
It had
along.
gone away.
Yeah.
So that helps a lot. And yeah, the recovery was not bad. Like, I would do my nose any day over doing my boobs again.
Yeah, it's
Honestly.
definitely good.
Yeah.